All right, good morning, everyone. We're going to get started with the panel today. I just want to say thank you for joining us today for our, on this beautiful Thursday. Our panel today is going to be the Regional Work on Opioid Use Disorder panel. And I just want to thank all of our panelists for being here today. So I do want to remind everyone, we are live on Facebook, and you are totally welcome to leave questions, comments in the comment section. And there is about a 45-second delay, so it may take us a minute to see your comment or your question. We'll be having monitors in the chat for our Zoom as well as the Facebook Lives. So thank you everyone for joining us today. Just remember, if you in the Zoom meeting today, please stay muted and have your video off unless you're a panelist and you are speaking. And yeah, let's get into it. We're starting today at 10 and we're going to be going until noon. So I first want to introduce our panelists, and I'm going to have you all introduce yourselves. I'll call your name. So we'll start with Jermaine.
Good morning, everybody. My name is Jermaine Brubaker. Oh, there, now you can see my face. Hi, everybody. My name is Jermaine Brubaker. I am the lead facilitator of RxSafe Del Norte, and welcome.
Wonderful, thank you. Rob?
Squeenakoi, Nakna Rob England. Good morning, my name is Rob England. I am the Health Promotion and Education Manager at United Indian Health Services, and happy to be here this morning.
We're happy to have you. And Glenn?
Good morning, I'm Glenn Hayes. I work for Open Door. I'm the SUD, MAT, OUD programs coordinator. So I work the programs all through our entire network.
Wonderful, thank you. Hilda?
Hi everybody, I'm Hilda Yepes Contreras. I'm the site administrator for Open Door Del Norte.
Thank you. Kathleen?
Good morning, everyone. I'm Kathleen. I'm an SUD counselor for the Talawa Dene Nation.
Thank you. Michael?
Good morning. Yeah, I'm the AOD counselor, KDEC 2 for Talawa Dene Nation 2.
Molly?
Hi everyone, I'm Molly Gallivan with CRIHB. I am the MAT champion for Northern California, so about Sacramento and above. Thanks for having me.
Thanks for being here today. Mikeia?
Squeenakoi, Naknau, Mikeia. Good morning, my name is Mikeia Washington. I'm a community outreach specialist with the Yurok Tribe Wellness Coalition and Yurok Tribal Court. Thank you for having me.
Thank you. Lori?
Good.
Good morning. I'm Lori Nesbitt. I work with the Yurok Tribe. I'm a tribal member. I'm in charge of the opioid program, the AmeriCorps Vistas, the Batters Intervention Program, and I oversee the Adult Wellness Program. And I have a CCAP too. Thank you and welcome.
Wonderful. Thank you all for introducing yourselves, and thank you for being here. We really appreciate the work that you do in our region. And yeah, we're just very happy to have you all here today. So now I just want to go over some quick group agreements for everyone watching today. We just want to remind everyone to please, be respectful, and kindness is key. If you're not being respectful and it becomes a persistent issue, you may be removed. Please show tolerance and sensitivity for differences. Remember that participants in the group come from different cultural, racial, gender, and sexually oriented backgrounds. So please be aware and sensitive to judgmental comments. And please use positive language and stay away from using any negative. This is a safe space and it is free of judgment, and it is all right to disagree with someone else's point of view. However, we just don't want to put each other down for it. And this is a space where participants should feel comfortable with themselves to share thoughts and ideas without any worry, punishment, or judgment. If you are sharing stories today, please remember to leave out specific names of their stories out of respect for those in the stories. You can say, I know someone who, for example, and just using name aids in the spreads of rumors and detracts from the point of the information trying to be communicated. So we ask that you respect people's privacy in those stories. And remember, for everyone watching, ask for clarification if you don't understand, and don't be afraid to ask questions if you don't understand the information provided. If you do have any questions or comments, you can leave them in the chat under our Facebook Live and in the Zoom chat, and we'll have people monitoring. If any of our panelists have any questions, feel free to ask them when we take a pause. And if you need me to repeat any of the questions today, feel free to ask me and I will make sure to repeat them. We also want to remind everyone that there may be some things that come up that may bring up some feelings or concerns. They may bring up some trauma. And so if you need to talk or reach out to someone, you can contact the mental health number in Del Norte, and the 24-hour crisis service is available. And we do want to recognize that each person's participation in this presentation is voluntary, and please respect the privacy of others and do not share personal information with anyone else. This training is being recorded and will be live on social media. Oops. And lastly, we just want to acknowledge the land that we are meeting on today. We are meeting virtually across many different lands of various indigenous peoples, such as the Taloa Diné, the Yurok, the Karuk, the Hupa, the Wiyot, and many rancherias such as the Elk River, Rezagini, Big Lagoon, Trinidad, Blue Lake, Table Bluff, and Ronerville. And we want to honor the indigenous peoples who lived together and cared for this land and each other since time immemorial. And we honor the gratitude, the land itself, and the people who have been stewards of this land for generations. We know the effect of colonization have impacted indigenous people disproportionately, and we hope that through this series we can learn together to help heal and work towards a healthy future. We also want to remind everyone that at the end of this panel today, there will be an evaluation. We will put the link for the evaluation in the chats for you to fill out. You will want to fill it out at the end of the panel today and just answer it to the best of your ability. Remember that each evaluation form filled out is an entry into our raffle, which will be announced at the end of this series. So thank you everyone for joining us today, and we'll get started right away. So I am going to start with the first question, and I will again go down the line and call out your name to answer, just so that everyone is clear. And then if you do need me to repeat the question again, feel free to ask and I'll repeat it for you. So I didn't introduce myself yet. My name is Malaya Florendo, and I'm the trainer with RX Safe Del Norte. My preferred gender pronouns are she, her, hers. And yeah, thank you for having me today. Thank you for being here. I really appreciate it. You're all my heroes for the work that you do in our community. So we'll start with the first question. So why opioid use disorder? And why is it so important? And why the Wellness and Recovery Summit? As part of the summit, what are you hoping the results will be? Jermaine, do you want to start?
Sure. So opioid use disorder is a big issue in our community, and it's something that people aren't necessarily aware of or understand the impacts of. We're really hoping to educate people.
You muted yourself.
Thanks. Talking away. So opioid use disorder is a big issue in our community, and it's something that people aren't aware of and aren't talking about enough, in my opinion. And I'm really hoping through this series that we're able to really educate people, make them aware, really engage them, not only in understanding, but in solutions on how to move forward and how to support the work, as well as to help those in their lives or themselves if they need help as well. And also, you know, really think about prevention and what are some of those root causes and what is it that we need to do as a group. I do have some statistics I would like to share as well, because these always blow people away a little bit. So in 2017, 72,000 people died of opioid overdose in the United States. That's a huge number. That's a huge epidemic. And I was just listening to NPR this morning, and they said that the rates are increasing by like threefold at this point due to COVID. So these numbers we're going to see increase exponentially as well, especially with fentanyl in as well coming into the market. And then with Del Norte County, you know, people think we're this small rural community that's not that highly impacted. In 2017, our numbers were almost 3 times the state average of opioid overdose deaths. That's 4 deaths, but we have a really small community. 4 deaths is a huge impact in our community. And it's important for people to understand that, and that this is a rural issue. It's not an urban issue. It's something that we need to look at in our communities as well. And also the populations of those affected isn't who people often think of when they think of opioids or opioid overdoses. It's a lot of prescriptions, and it's a lot of the older population in our communities. But what this statistic is always something that blows me away and blows others away is our prescription rates are so high. In 2017, we had almost 34,000 prescriptions for about 27,000 people in our population. And we've been working really hard on getting opioid alternatives to pain management, reducing prescriptions, things like that. But this is a large number, and this is something that we need to be aware of. Also, who is affected is also important to understand. And unfortunately, disproportionately, our Native American population is the highest affected when it comes to opioid overdoses. And a lot of this is in the Klamath area as well, and that has a lot to do with lack of services and just if somebody has an opioid overdose in Crescent City, right, the ambulance is right there. In Klamath, not so much either. So there's a lot of factors that go into why that could be. But the big thing to understand is that this is an issue in our community, and it is affecting people. I have gotten a lot of just anecdotal people coming up to me and telling me about family members that they don't know how to help. And we're hoping through this that we can really help people figure out how to help them, and also to just understand what's going on in our community. Thanks.
Wonderful. Thank you. I really appreciate you sharing the statistics. All right. Now, Maikia, would you like to go next?
Again, good morning, everyone. My name is Maikia Washington. I will be co-presenting with Lori Nesbitt. She's the Yurok Opioid Program Manager. And to answer your question, opioids it's a devastating issue in the community in Humboldt and Del Norte County. And we do have some information that we want to share with you all today about why it's such an important issue to address. So I'm just going to share my screen here and share some data with you all, specifically focused on the Klamath area. So I just want to highlight that in Klamath and Witchpack and Hoopa, in those zip codes, opioid prescription rates were extremely high. Specifically in 2018, if you look at zip codes 9, 5548 and 95546. Again, that's the Klamath and Witchpeck area. 51,841 opioid pills were prescribed for 4,867 residents. That number is completely outrageous, and it can lead to a tremendous amount of opioid misuse and abuse. So essentially, that's 10.6 opioid pills per resident per month. That's enough pills to develop an addiction, to develop a misuse issue. And Lori, would you like to speak on this particular piece about how heroin use is part of a larger substance abuse issue, which often leads to the use of other drugs?
Can we go back to the other slide?
Yes.
So I was prepared to answer the question number 1 with this slide, and there's not very many Native people, and we've been devastated before, and so to have one death, one suicide or overdose from these opioids is a devastation to our future. So each one that we lose, that's another generation, and we have to continue our heritage and our enrollment and our tribe by keeping people alive. And if there isn't any education and knowledge of how to get control of this, the other thing is that people need to know that part of the opioid addiction is not their fault. Pain, this is a pain medication. So for instance, if they have a surgery or a major accident, they're giving opioids. And if they're given too many because of the distance that they're from the facility, say like 30 days supply, they start to overuse that supply. And when they withdraw, they have more additional pain. So my intention of showing this slide is people need to know that they have control of how much opioids that they use, or having a choice of what kind of pain medication that they can receive. And I'll stop right there with that slide.
Wonderful. Thank you both for sharing. All right. Glenn and Hilda, would you like to go next?
Sure. Could you repeat the question again? I don't want to answer too far into it.
Yes, of course. So the question is just, why opioid use disorder? Why is it important? And why the Wellness and Recovery Summit? As part of the summit, what are you hoping the results will be?
Okay, so right there. So first, I'd like to start with why it's important to me to work in this area. And some of these answers will mix in through the rest of the questions as well. I make a statement, and please let me explain the statement before you react to it. Drugs aren't the problem. If you use opiate in the correct way because you broke your leg, it works great. It's very helpful. And I know we're focused more on opiate, but it's the same with meth. If you have a pharmaceutical stimulant for someone who has ADD, it works great. The problem is we as human beings don't continue or discontinue use of it, and it becomes habit forming and turns into the addiction. So drugs, like I said, the opiates aren't the problem. It's us as humans where the problem lies. So that's why the summit is so important to me, is just to get that message out there, is that there is something we can do about that. Why I want to do this is to get the understanding of the impact this has on our families and our communities, and what will happen if we don't do anything about this is people will continue to die. It'll continue to destroy our community, and it won't change. I mean, we have proven the only change we've had is the increase from the lack of services for this. So to me, the big part of this wellness recovery thing is to educate people and to reduce the stigma and, you know, to create an understanding.
I want to add to that remember that the opioid use disorder is a chronic lifelong disorder, and it has potential life-threatening consequences like, you know, disability, relapses, and, as Glenn said, even death. So we really need to wrap our wagons around people with this disorder. Thank you.
Wonderful. Thank you both. All right, Kathleen and Michael, would you like to take the floor?
Yeah, I mean, I'm amazed. Thank you for all your answers. I agree with you all. The reason why I'm here is I'm a substance abuse counselor. I've been in a substance abuse counselor for 13 years. It devastates our community. I'm part of this community. You know, this is where my wife and I are going to retire to. I love this community, but through the drug addiction, you start to see the homeless population grow. You know, you start to see the criminal aspects grow. And they're not criminals, but they'll do some criminal stuff. But it's as Glenn and the way he was talking, you know, I'm here because drug addicts think like drug addicts, and our program is a CBT program. We could try to help them in their thinking. You know, we try to show them how obscured their action and their thinking is. That's why I'm here. I'm here because I see what happens after we have helped the addict and how they help our community. They can become coaches. They can become teachers' aides. They can become those people in our community. What makes a community, you know, that's the reason. It's funny, I had these statistics, and that next slide was my statistics in my head about 2 times likely if you're alcoholic, 3 times marijuana, cocaine, and methamphetamine, and 44% most likely if you have prescription drugs. So everything what I had to say to you guys, you've already said it. So thanks a lot.
Thank you, everyone, for all the information that you've passed on. And Glenn, I really like the way that you think, because that's the way Mike and I have approached our clients. And it's not the drug that's the problem; it's the thinking that's the problem, and that's what needs to be changed. And that's why I'm here. I'm a substance abuse counselor. You know, in this community that Mike and I work in. There's a lot of enabling through family members for the addicts and to continue their use, and the need for education on that level is really important. And also in this community, opioids are looked at as a stigma, very much so much in the Tolowa Dene Nation. Drug use is a stigma. For some reason, alcohol, not so much, but the drug abuse is. And you know, I'm here to help what happens with the aftermath with the families too, because that's very important. I've seen families being torn apart from this this disorder. I've seen children be taken out of their homes and placed in different homes and not understanding why they can't be with mom and dad anymore. So, you know, that's why I'm here, and that's what I do, why I do what I do.
Wonderful. Thank you both. All right, Molly, do you want to go next?
So I just wanted to reintroduce myself. I'm Molly with CRIHB. So that stands for California Rural Indian Health Board. And we're out of Sacramento, Roseville area. And we kind of operate as like a state level entity. And so for me, when I graduated in May, last May with my master's degree in public health, and I knew that I really wanted to do something with opioids. And that was because, you know, this is the largest drug epidemic that our country's ever faced. It's affecting everyone across the country. You know, it is more of a rural issue. And I grew up in the North State. I grew up in Chico. I knew I wanted to come back to Chico and help my community. But I'm so glad that I've had the opportunity to kind of work in all of Northern California, because all of Northern California is very important to me and I consider it home. And, you know, when we were talking about drug addiction in one of my classes, one of my favorite classes was health disparities or health inequities. And I knew from kind of personal experience and growing up in Chico that, you know, their AIAN, Native Americans are, you know, face a lot of issues at like a disproportionate rate. And in my textbook, there was literally one paragraph about Native Americans when other ethnicities got entire chapters. And I was like, what is this about? I even asked my professor. And so when you look at the graphs and charts, I didn't provide one today, but maybe someone will show one later. We're actually like in a third wave of the opioid epidemic, which started, you know, in like, some people say the 80s, some people say the 90s, but since 2016, the graph's just kind of gone straight up. And right around that time, I lost my best guy friend from high school to an overdose. And he had a 1-year-old. And so he, you know, recently married and everything. And that was really hard on me. And, you know, it's like I said, it's affecting everyone across the country, but it's affecting rural communities more, and it's affecting the Native American community a lot. You know, I think the statistic that we always use at CRIHB for our presentations is it's between like 2009 and 2015, the overdose rate in the Native community rose about 500%. But also breaking that down to all the like per capita stuff. And Mikey, I'm really happy that you shared that statistic with Yurok, because that is outrageous and insane to me. But American Indian Alaska Natives are 6 times more likely to overdose. And I think that is due to, you know, to them being very remote and the reservation system and rancheria system and all of that. And so it's really important for me to try to be a resource and come into these communities and try to help. And I'm really excited for this today because I think it's going to be very educational, or I should say for the month. I think this is a really cool event. I think it's really innovative, and I, you know, hope it proves to be very educational. So you guys, you know, can go back and figure out what the needs of your specific community is, or even your family and friend group, whatever community looks like to you. And, you know, hopefully we can support you and you can go back and try to make a difference in whatever way you think you can. So thank you.
Wonderful. Thank you so much for sharing. All right, Rob, you want to go next?
Yes. So thanks to all the panelists for sharing all the statistics and information. And I'll just try to add a little bit different as far as our perspective at UIHS, because some of that has been said already. So our involvement with opioids had to do with getting grants through subawards through the California Rural Indian Health Board. So thank you, Molly, for being here. But when we look at the vision at United Indian Health Services, that's for a healthy mind, body, and spirit for generations of our American Indian community. And when you look at these prescription rates, overdose deaths, and this is just looking at one health issue within our, our Native community, our tribal community. And the thing, if we truly want to have, better health for our Native community, we have to look at all aspects, and I know that there are certain topics that we're all passionate about, but looking at the whole person, and, the numbers are out there, that this is a huge issue, and what are we going to do to address it? So some of the things that we did at United Indian Health last year, besides getting our team initially educated on the topic ourselves before we could become the educators, within our community, was that we had our own tribal opioid summit last June. And we were amazed at the response that we had to that summit. We had 250 people attend over the course of 2 days. And many of the comments that we had from our community, which included our community partners and some of our tribal community as well, is thank you for bringing this to our community. It's, a fairly recent issue that's being addressed in the scope of health education. And we also found that, as well as tabling at other community events and saying thank you, and just seeing the overall impact that people had from their own personal experience, whether them as individuals within their family, almost everybody within their family had some sort of reference and personal experience. And then just seeing how our community has been impacted. And I think this is some of the first steps that we really have to address, and decreasing that stigma, talking about it, talking about those who have been through it, those who, are going through their recovery. And I know, as far as, in our community, we talk about what we don't have. We're rural, smaller than a lot of different areas, but I don't think we really maximize the services that we have. So bringing some of the awareness from our organizations, tribally and locally, and what we can do to offer services to our community members that really need them. So I just want to thank RxSafe Del Norte for including us as a partner in this series. I think it's really important in the time of COVID-19 to continue our community education. We're not able to do that via tabling or having workshops, within our community, but we can bring it online. And, if people aren't here live today, that this will be a resource, a library resource for others to connect in the future. So thank you for organizing this and inviting all of us to the table.
Thank you. And thank you to all our panelists for your responses on why you're here today. It's just greatly appreciated, the work that you do. And like many of you had said, almost everyone knows somebody who is affected by OUD and SUD. And so it is important that we are doing this work. And I appreciate all of you for sharing your reasons why. So now I want to know more specifically, what is the role your organization is playing in helping around opioid use disorder and substance use disorder? I'm going to pass it along to Jermaine.
Hi, again, Jermaine with RxSafe Del Norte. And we are, as our name implies, a coalition. We're county-wide, so we cover the whole county, and we try and work with the other opioid coalitions and other key stakeholders, as well as people who are suffering from opioid use disorder. We always try and center the work around people who have lived experience as well. So we're always trying to make sure that we're including their voice and including them in the solutions that we come up with to move forward, instead of just sitting at the table making decisions for people. We want to make sure people are included in those decision-making processes as well. So I'll share just a little bit. I like to hide behind my PowerPoints if I can. So let me just pull this up here. You can probably see my things there. So our mission, and we have our lovely logo now that Malaya, our host today, designed for us. So, but our mission is really to engage the community in the prevention of opioid use disorder and reduce stigma, promote treatment, recovery, and wellness. So we're not direct service providers, we're bringing people to the table to do the work. And we have a monthly coalition meeting, and we do lots of work in between. We're grant funded, and our coalition is open to anyone who wants to join. So you don't have to be part of an organization. You don't have to be someone who has something necessarily to bring to the table other than your perspective, your point of view, and your willingness to make change in the community. So we want to make sure that we're always being inclusive of everyone out there. And just a little bit around kind of our strategies. We did a lot of research over the last year, and we talked to a lot of different people, and these are some of the things that came up that people felt that we needed in our community to help start addressing opioid use disorder. Education and outreach was a big one, and this is one of the results of that is this Wellness and Recovery series. We originally wanted to have a regular summit, and we've had to move because of COVID, but I think this is actually going to reach different people in new ways. So it's actually kind of a blessing in disguise, in my opinion, of how we're doing education and outreach. We're really working to create and destigmatize and educate as much as possible, and really move that needle from myths and stigma to culture, trauma-informed approaches to opioid use disorder, people realizing that addiction is not a choice, it's a disease, really working against some of those myths that are out there, which is a large barrier, is that people really still put a lot of moral judgment around addiction and opioid use disorder. And we want to really help people understand it's not a choice. No one chooses addiction. There's a lot of things that go into it. Genetics, life circumstances, trauma, exposure. There's a lot of different things that contribute to this disease. Just like if you get type 2 diabetes later in life, you may have not been making the best diet choices all along. Some people will get the type 2 diabetes, some people won't. And, I know plenty of people that eat lots of sugar and are still healthy. But in my family, there's those genetics, and I have to be more careful. So, in addition, bringing harm reduction to the table. We had a great presentation about harm reduction by Hatcher at the beginning, and really it's, naloxone, trying to get medicated assisted treatment in the jails, really looking at alternative pain management options, really supporting those efforts like needle exchanges, and really trying to destigmatize those and help people understand how it can help reduce needle litter and actually help people on that road to recovery. This whole idea of trying to bring services together and connect people better to the resources and services. Rob talked about how we do have work happening and we have resources here, but educating people about them and having even people who are in the work, the case managers and the people, substance use disorder counselors, understanding all the resources that are out there and getting those things connected. So we're building a database right now. We're going to connect with the Humboldt one that's happening to be able to get more resources out to people in a more timely manner, easily accessible. and really be able to have people have what we call warm handoffs, where it's like, we know this person is going to help you. This is their number. Here, we can call them right now. So it's not just that, no, we can't help you, slam the door in your face, you know, good luck next time with someone else, right? We want to really help. When people ask for help, that's the time to help them. We can't give them a 2-week wait list. We need to get them services as soon as we can. And always trying to build sustainability, reduce those prescription rates, increase the alternatives to opioid prescriptions for pain management. And like I said, always trying to center that lived experience of the people who are in the trenches, both with opioid use disorder and those who are on the front lines, really trying to help people get those resources and get on that path to recovery and stay on it in a healthy way. So, you know, we're really that support system, that backbone that's really trying to help braid those system pieces together as much as possible. We've had a lot of successes. This, I think, is a success. The fact that we're all at this table together, talking together, that's a great success. And it's something that not a lot of communities could say that they can do. And barriers always are, you know, stigma and funding. We always need more funding so that we can continue the work and keep people going. So, you know, we want to make sure that we're continuing to support each other in this work. And time, this is a crisis that we've been in for a long time. So it feels very urgent all the time because we're seeing deaths, we're seeing people hospitalized, we're seeing families suffering from this. So it's imperative, it's something that's urgent, and it's something that we want to address as soon as possible. So, but we are successful. We've done a lot in the last 2 years that RxSafe has been going on, and we're happy to continue to do more, and we hope other people can join us.
Amazing. Thank you, Jermaine. Wonderful start to that question. So thank you again, and I want to pass the mic along to Micaiah and Lori.
Thank you, Jermaine. That was so informative. That was well said. That was awesome. Yeah, so the Yurok Tribe Wellness Coalition is really dedicated to battling the poisons of addictive substances in the community by restoring beliefs in family values, spirituality, and cultural responsibilities. So the Yurok Tribe Wellness Coalition mainly works with YHHS, which is the Yurok Health and Human Services, and Yurok Tribal Court to really advocate for this work and to build partnerships in the community, to start conversations that really need to be had so that we can address this issue. Jermaine touched on this a little bit earlier, but there's so much stigma associated with addressing substance abuse. And we are in the midst of a crisis, and this is the time to have honest conversations about what works and what doesn't work. So that's what the Yurok Tribe Wellness Coalition does through hosting different community events and meetings and dialogues. We've been engaging law enforcement throughout Humboldt and Del Norte County, and now we're actually working on a plan to reach out to Trinity County because that's the service area for the Yurok Tribe. So we're starting conversations with law enforcement, service providers, healthcare leaders, individuals that work in the justice system. So we have support from the judges in joint jurisdiction, especially Judge Abby. And we're really working to continue that dialogue so that we can have a conversation about healing, an honest conversation. And not only have a conversation about it, but then start working to connect individuals in the community to the resources and services that they need so that they can then have tools to promote healing in their families and within themselves. So again, it's rooted in addressing family, the family, and wrapping services and resources and support around families through cultural cultural development. And that's really the basis of the work that we do with the Yurok Tribe Wellness Coalition. And again, we do meet on a monthly basis with our partners and stakeholders. We have around 70 coalition members engaged. And again, these are community partners throughout Humboldt and Del Norte County and Trinity. And now we even have a partnership with the California Opioid Safety Network. So we work with individuals throughout the state of California to learn about how we can address this issue and what are some practices that work and quite frankly, what doesn't work. And we find that we have to always tailor these practices to really meet people where they are. And I know Lori will talk about that more in depth, but that's the basis of what we do, because the goal is to also promote wellness and mental health in every aspect: physical, mental, and spiritual. So that's addressing suicide, overdose deaths, recidivism, and really promoting healthy lifestyle choices in the community. And I will say that this work has been healing for me as well. And I really like to think of this as light work, as spreading the light in a time of there's so much darkness and there's so much uncertainty, and we're really working to work with the families here to spread that light work. So we'll be actually planning some virtual events as well, to specifically targeted towards the youth. These will be art-based, hip-hop, music-based events just to get the youth engaged. And again, that's wrapping services and resources around the entire family and really inspiring more voice and honesty out into the community. So thanks for having me, and I'll let Lori take it away.
Thank you, Micaiah. Good job. Could you get that second slide ready, Micaiah, please? And first of all, I guess I want to start on barriers as an information out to everybody. We've talked around it, but as a whole, treating the families, we have homeless, poverty, housing, multiple drug use, legalities of convictions of crimes, and domestic violence. So all of those are hinged on the hub of this slide here of drug addiction. And we can't address any of those barriers until the addiction is subsidized to where we find the person inside that wants to do the right thing. And until a recognition of the use of any of these drugs is addressed, they can't make sense or find in within themselves to do the right thing. And I just feel like this is a barrier of communication that has been done generationally. And to make sense of this slide, those who are addicted to alcohol are two times likely to use heroin. And as you see, it goes clear up to 40 times for opioids. And of course, marijuana has been minimized traditionally, generationally, of a use of drug. And when it's done medically and controlled, there is a space in that in our world, but that's not where majority of our people in this area use marijuana as a medical controlled substance. The other barrier that I think is been talked upon in our area is release of the information. So as you can see, our panel and our area of minimal services, Yurok Tribe has a different direction of how we address the people. We're not a medical facility, and we appreciate every person that's on this panel as a medical facility to address the addiction, and that's their part. Our part is outside that door. outside the medical facility, outside the jail, outside the court, outside housing authority, outside of any of those stakeholders that are at this panel. We case manage to hold up those people to be able to assist them in going after that housing application, go out after that driver's license, go after that reunification of their families. And we have welfare and TANF system that gives them a hand up to get on their feet. And I think those barriers can be addressed by having releases of information through all of these stakeholders of when they first come into this office to you, Yurok Tribe is able to address those Yurok tribal members. And if they have a Yurok child in that house, or if they have a Yurok partner or spouse in that household. So that opens and broadens what the Yurok tribe can do, because Judge Abby wants to assist the family. And one of the barriers that has not been addressed is aftercare. We are all struggling to figure out what a safe place to land after they go to treatment. And that is a big issue in our area of aftercare. Yes, we have sober living, but it doesn't put the family back together. And so that is what we're working on really hard. As a goal is to establish an aftercare system. We always use the phrase, it takes a village to raise a child. How are we doing? If we test ourselves, we're not doing that. So I think the strategy of getting that going and addressing those issues as coalition workers, if it takes us to go clear to the whole California and get funding to address Northern California, we got to do that. We need to come together and put the red flag up and say, we need help up here. And we're not going to give up. It's a red flag, not a white flag. And that's my strategy to get here. Have we had successes? Yes. We have reunified families. We have addressed overdoses. We have several programs within our Yurok tribe. We have the suicide prevention. We have victims. We have legal assistance. We have outreach programs, the wellness court. We have a youth program. We have a child support program. And we have a very strong team addressing all of these issues here. But of course, it's already mentioned today, funding. And I think I've said my piece for this question. And thank you.
Thank you both so much. I really appreciate you speaking to our Indigenous communities, and it's so important, and I just appreciate all of your words. So now I'm going to pass the mic along to Glenn and Hilda.
Hi, everybody. Thanks for your participation and your answers. It's really, really heartfelt. Some things have been said. So the role of our organization, first, we're a primary care facility which treats opioid dependence as truly a part of the whole person care. I feel it's nearly impossible to help somebody get off of harmful drugs and expect them to be successful without addressing these other factors in lives. So, I think that's where our role is just to really embrace the entire person and try to heal as much as possible. The goals is, for us, is to get the community to understand that this is a disease, not a moral failure. A lot of people see that, and it's really easy. We make a lot of choices that get us to this spot, and then we have to make some really tough choices and some tough actions to get us out. And I think that's why people have such a dedication to keeping this as a moral failing. And it's just a choice, but it's not. You know, we choose to eat unhealthy, and eventually we work ourselves to diabetes, and we have to make some choices that some of them can't even be changed after that. And addiction's that way too. Our strategies, you know, I can talk about mine particularly, and that's what I try to lead with. My top strategy is to remain open-minded. You know, this means meeting people where they're at, not where I think they should be. We use MAT to help people get past that sickness that often controls their thoughts and their choices. I mean, when we have the flu, we don't make really healthy choices. We just want to be left alone and, you know, do whatever it takes to not be sick. So the strategy is with us is the MAT, to give them an opportunity to feel okay, to let our counselors, our case managers, our behavioral staffs, and medical providers work on these core issues that the person's battling with. Barriers, if you know me, you will hear this to the point you get tired of hearing the word stigma. Barriers, stigma, stigma, stigma. Before this is over, I'd like to tell you a story about my son, and we'll get to that. But I think one of the biggest barriers that we have is, you know, of course, access to treatment and keeping and getting providers in this rural area to work with us. We have such a struggle with that. I'm working with an outside agency. I'm also working with both in doing virtual visits, just so we can have a provider on staff as much as possible. My goal is you contact Open Door to get into a program, 28 to 48 hours, you're in. Not just doing the application, not just doing the pieces of it to work towards it, not on a waiting list, but in. And I will not stop till I achieve that. So hopefully I never have to stop, but I achieve it anyway. Success is part of this question, right? Okay. So successful is MAT in general. It's a life-saving medication, but it's not enough by itself. It's medication-assisted treatment. So often we forget that assisted piece. And to me, the biggest success is when our community, not just our providers, but our community in a whole, understand that treatment has that counseling aspect to it. So the more counseling, the more behavioral health I see getting involved, the more success I feel we have achieved. We break a toe, we go to a doctor, no big deal. We break a heart, we suck it up, and that's not right. It should be normal to go to treatment. It should be normal to go to behavioral health for counseling. It should be normal for all these things, just like it is for going to the doctor. Success is letting people know that we care and we're here.
Also, the other part of successful is when we have people going through the MAT program that you just don't think that they're going to make it, and they're getting their kids back, and they're getting jobs, and they're going to school. That is successful. They're reintegrated into the community that had this stigma, you know, that they weren't going to amount to anything because they're low life, because they're opioid users. And it's just so exciting to see that they're reintegrated back into the community.
Wonderful. Thank you both for your responses. I'm now going to pass the mic along to Kathleen and Michael.
Thank you all for the thoughts that you had and your approach and sharing it. Here in the Tolowa Dene Nation, we have a wraparound program that brings in culture, it brings in the social worker, it brings in if we have domestic violence. So we all wrap around and get together as a team and try to figure out a treatment plan for that specific person. one of the things that Michael and I do is that we meet our clients where they're at. We don't, like you, Glenn, we don't push our beliefs on them. We also have a culture advocate that starts to introduce the culture back into the client's life, because what we have found is that the stigma that comes along with the use is maybe they danced when they were younger, maybe they did, were involved in their culture when they were younger, but because they have a substance abuse problem, they have been pushed aside and know that that's not part of their tradition, that they're not clean, so they cannot participate. And so we try to help them to come back and be part of that too. And one of the things too is that Mike and I help to do is that we found out one of the things we started to do is we were just, having treatment for just the client at first. And then we saw that when that client, because we're an outpatient outreach program, and when we saw that when that client went back into the environment that they were in, that, they were still having the thoughts that they were having, and they would come back and they wouldn't know how to handle it. And there was some times where there was relapse and stuff. So one of the things that Mike and I had made the choice of is starting to not just to treat the client, but also to treat the family at the same time, so they understand about the disease, to educate them, to give them tools too, so they're not, because it's like a dynamic that they all feel comfortable in, because they all know what to do. So that's what needs to be changed. This person knows what button to push for that person to react and to get the reaction what they want from them. So it's trying to teach them. And then when we're doing all of this and we're trying to change their thinking, what we're giving them is resiliency. So they don't have to relapse, so they can continue their lives, and so they can be successful. And so, we do have success stories. We just had one too long ago, just like yesterday, we had a client, two clients, a mother and a daughter, who are moving on into the second stage of our program because, we've been able to walk them through a lot of things where there was role reversal and stuff in the family. And so now that's not the reverses. The roles have been reversed back again to where mom is mom, kid is kid, it's going really well. And it's, and that's one of our success stories too. And, I love, Jermaine, what you had on there, the harm reduction, that's what we're about, if we can get you to harm reduction, we're okay with that. If we can get you to where you have resiliency, we're okay with that. Our program is not just for the Tallawah-Dene Nation. We welcome all Native Americans into our program, and that's what's really great about this program. It doesn't matter if you're Yurok, if you're Karuk, whatever tribe you come from, we are willing to help you. I'm just putting that out there for all of you to know that. Anyway, I think I've answered all the questions.
Thank you. Yeah, once again, I'm proud to be on this panel. I can love what you guys have to say. Once again, we can meet our clients where they're at. Kathy and I are our counselors, what are on the line. Working there, working with the individual one-on-one. It's funny, the stigma of just the poor could be addicts. No, everybody, I don't care who you are, that stigma has to be erased. People don't realize that their mother, their father, their uncle, the banker's brother could be an addict. So that has to be erased so that our community realize we're in this together. And I really loved what was said about the harm reduction. There many years ago, I can realize that where I used to work with, they used to evaluate how many stays clean and sober and how many doesn't. That's how they used to look at things. And I don't see it this way. Kathy doesn't see it this way. If I work with a gentleman who can just gets out of prison and he's back in prison within a month, and he could stay out of prison for 3 years, that's a success. You know, if and I work with a father or a mother could stay clean and sober X amount of time, and they've never stayed clean and sober that much time before, that's a success. You know, our job is to encourage them not to give up. Our job is to understand their struggles, to understand that the stigma, understand the ignorance of other people, and help them to understand that too. Understand that people will say certain things, and because they're ignorant. And lots of that comes from the family. Lots of it comes from the community. You know, lots of people likes to judge people who's never walked in their shoes. You know, that's our job. Our job is to encourage them to not to give up. Our job is our first stage of our program is nothing more than looking at their thinking, showing them ways to keep them going, to stay clean, sober, look at who you're hanging out with. Emotional reasoning's a lot. You know, don't use your emotion because it's your family. My family's going to save you. You know, lots of families around here is going to kill you. They're going to kill you. You know, just because it's family, they love you, but they're going to be crying at your coffin. We need to show them that don't use emotional reasoning, weigh up the facts. How well has your family helped you? Well, if they haven't helped you, maybe you ought to take advice from somebody else. And I always tell my clients, don't take my word for it. Do it and see if it works. And now you have some evidence that backs it up. You know, never take my word, but please try what I suggest to do and just ask you the simple question: does it work? Did it give you some relief? So once again, we're just counselors. We're counselors for the you refer them to us, and then that's when we take over. And once again, what's neat too is, I believe what Glenn's saying is that we have a small window of opportunity. I've seen that for years, and you better jump in that window, because soon as the pain quits, all of a sudden they're well and wonderful. Mm-hmm. So you better convince them when that pain's there, and then reinforce that with we do thinking reports, we do behavior change, and we like to do Socratic questioning, paperwork, and all that gets them to look at their thinking, to get them to look at their thinking, get them to look at their thinking. So once again, I cannot tell you how proud and happy I'm with all of you folks. It looks like Del Norte County is well representative. This is my 3rd year living here. I was working at the prison as a counselor. Before that, I was working at an air prison, High Desert. And before that, I did 8 years by Sacramento. So we got a well group here, really informed and cool. Thank you.
Wonderful. Thank you, Kathleen and Michael. Yeah, you're doing amazing work, and I really appreciate your responses. So now I'm going to pass the mic along to Molly.
Okay, so I really echo everything that everyone has said. Prior to this job, which I just started in December, I worked at a federally qualified health center for 4 years, and they had their own Suboxone program that I had an opportunity to work in. I think whole patient or whole person care is really important. You know, we implemented like a social determinants of health questionnaire, and I for Suboxone group, I sat at the front desk and checked people in, and I also just like checked in on them and had personal conversations with them. And a big thing for me was, you know, I was kind of covering like the insurance piece at first, but, you know, we were offering our social determinants questionnaire to like anyone that met with me for insurance, but you would have to be at the point where you would want to make an hour appointment. And I was like, hey guys, I'm not trying to ambush you sitting at the front desk, but like, let's talk, what's going on? Like, you know, and as every week me sitting there, we kind of got to start having conversations and things like that. And we definitely had success stories coming out of those groups. And it's just really great to see people get clean and you know, just live the life that they want to be living and reconnect to things that made them happy and important, whether it's family, whether it's working, whether it's, you know, like with the Native community traditions and things like that. So that was really, really, really like life-changing for me, just because I had never worked in that kind of capacity before. But now with this current job, it's a little different since, like I said before, I'm more on like a state level. So for me, it's just showing up, hearing everyone's stories, hearing what's going on in the communities, and just kind of being almost like a fly on the wall, because I'm not an expert, and you guys are the experts in your communities, and that, you know, resiliency and that passion that you have for your community and making it a healthier and safer place is really important. You know, and I also have that here in Chico, and I have the opportunity to work with North Valley Indian Health down here too. So it's been really good. So for me and for my program, we're one of 5 partners, state contractors for TMAT, so tribal medication assisted treatment. And we're working specifically with the rural populations. For me, it's just, like I said, working with the specific, what we call TLOCs, or tribal local opioid coalitions. And I just kind of, like I said, just work with them, whatever they need. I'm here, I try to show up. And that's, you know, being in Chico, I'm closer to, I could be up for a meeting or be up for something kind of at the drop of a hat. But right now, I would say a big barrier is that we do have a travel restriction through CRIHB right now due to COVID. So that's been kind of hard. But it's great to see that like the work is continuing on, and you know, we don't stop just because there's a pandemic going on. Like, we got to keep showing up and doing the work. And I also just want to say, like, there's just besides resiliency, there's just so much hope. And kind of going back to what Mikey was saying about being the light, I think that's really important to think about in this work. So thank you.
Wonderful. Thank you so much, Molly. All right. And finally, I'm going to pass the mic to Rob.
All right. Thank you once again. And again, I want to go ahead and say the vision of UIHS, which is the healthy mind, body, and spirit for generations of our American Indian community. And that really is our goal. And so some of the strategies to maintain that goal, you know, we have 7 different clinic sites within Humboldt and Del Norte County. So we're trying to access our tribal communities and meet them where they're at. We also have a wide range of full health care for our community, where they could, in addition to getting their health care, they could access medication-assisted treatment. We have a behavioral health department where they could get their counseling and substance abuse counseling as well. In addition to that, within community health and wellness, we have a health promotion and education section, and that's where I'm a manager of that section, to provide this community education and increase some of those individual knowledge and skills about health topics that are impacting our community. Also just fostering some of those coalitions and networks and being at the table with RX Safe Del Norte or Humboldt partners, and then also hosting our own Opioid Awareness Coalition for the last year and a half as well. And so those are just, you know, some of the things that we have done. You know, one of the things that I have to mention is just that everything has changed, you know, for everybody here on this panel regarding COVID and how do we proceed from here, and trying to really access, you know, technology, making us utilize technology like we never have before. I know that we've really had a social media outreach from our organization that probably wasn't as strong as what it should be, but you know, due to the pandemic, we're improving in that area, which is a good thing. And we're also promoting telehealth as well. And we're finding some really good successes with telehealth that maybe we never would have found before, you know, without this happening. So, you know, with, you know, this devastation to how our reality used to be, I think there's going to be some positives about access to care as well. And we found that some of our community prefers that. And I think from this point forward, we're going to have a hybrid of some sort of how we provide services to our community. And so just trying to go along with that, having many different outreach strategies that, you know, we weren't fully accessing in the past as we move forward with this. So I'll just go ahead and cut that question off there because I know we have a couple more before we are off this panel. So.
Thank you. And thank you everybody for answering that question and, you know, giving us what you and your organizations are working on. It is so imperative to our communities, and I appreciate all the work that you're doing and you sharing it today. So with that, I do want to ask, you know, what do you wish people understood about opioid use disorder and substance use disorder and your organization? So we'll start off with Jermaine.
Hi again, Jermaine with RX Safe Del Norte, and I'm going to stick mostly to the first part of the question, what I wish people really understood about opioid use disorder, substance use disorder, and addiction. And I just want to emphasize again that it's not a choice and it's not a moral failing. And I think that we put so much emphasis on that, and that creates this huge barrier for people who want to reach out and get help. Both families who are afraid that they have failed somehow with their child or with their spouse or their family member, so they're afraid to ask for help, as well as those who are looking to get help with recovery. I've heard people who are in recovery that are afraid to even talk about the fact that they're in recovery because they're afraid that they won't be eligible for jobs or they'll get shunned by people in their community. So really understanding that addiction and opioid use disorder, there's a lot of reasons why it happens. There's a lot of factors involved. It changes brain chemistry. It changes the way your body functions. It changes the way you feel pain. There's a lot of things that go into addiction, and it's not because somebody is a bad person. It's not because somebody doesn't have the moral backbone. It's because of a lot of different factors. And the more that we can look at people as a whole and holistically as well, and really support the whole person and the whole family, like people were saying again, like giving tools to people to understand how to support people while keeping healthy barriers, you know, because people are also afraid to enable that family member, right? They're like, well, if I help them, I'm not really helping them, right? And so there's a lot of fear around that, so that we need to break down as well. So there's a lot around the stigmas that we really need to address. Also, just kind of understanding recovery is a journey and not a destination. right? So the idea around recovery is something that is not an endpoint. It's something that is ongoing for people. And it's something that is not an endpoint. It's a journey. It's their whole lives. It's something that means that people have strategies and tools to stay in recovery long term and stay healthy and stay well, which is one of the reasons we call this a wellness and recovery series, because we really want people to emphasize the wellness part too. Like, how do you stay well? And when people are addicted to opioids, they're trying to, I think Glenn talked about it a little bit, but it's this sickness, it's this feeling of being sick all the time, and they're trying to find that wellness. And often that is the easiest way is to continue to use. But there's other ways out there, including medicated assisted treatment, which has its own level of stigma that we also need to address, because a lot of people don't think that medicated assisted treatment is actual recovery and is actual, because they're still getting a substance in order to help them be well so that they can stabilize. And that it's not, again, medicated assisted treatment isn't something that you take once and you're done, right? Because of the brain chemistry changes, because of the physical changes that happen around addiction, that it's something that's a long-term strategy plan. It's something that helps people stabilize, helps reduce those cravings, helps get people to a place where they can get off of Suboxone or whatever their medicated assisted treatment is. And so we really need to work on the stigmas around that as well in the recovery community as well, so that we're supporting everyone on their individual paths of recovery, that we're not just pushing abstinence, that we're pushing harm reduction, that we're pushing medicated assisted treatment. We're helping, as people said over and over again, meeting people where they're at. And meeting people where they're at doesn't mean that you're not going to continue to offer them that hand up or that handout, and you're not continuing to give them empathy, and you're not continuing to help give them the tools to reach further on that path to recovery. But it means that you're not shaming them, that you're still being there for them, and that you're still kind of giving them the tools that they need at the point of their life that they need it. So if, it's a medical thing, it's a social thing, and it's something that we need to address. And looking at some of the base causes too that are prevalent in our community: trauma, poverty, lack of access to resources. Those are all some of the base things that are across the board. And if we're addressing that for this community, we're going to be helping many other communities, not just those with opioid use disorder. So we need to really think about that these are our people. They're not somebody else's people. They're all our people, and we need to treat them as such. Thanks.
Amazing. Thank you, Jermaine, for sharing. It's greatly appreciated. All right, now I'm going to pass the mic along to Micaiah and Lori.
Wow, Jermaine, thank you for sharing that piece. I just want to start off by saying that I am no expert here. I'm from the Washington, D.C. area, and I went to a school called Frostburg State University, and Frostburg, Maryland is actually located in a very rural region in the Western Maryland, West Virginia, Appalachia, and mountain area. And I have some experience working with opioid coalitions there, but when I moved out to California, I wanted to serve as an AmeriCorps Vista volunteer with the Yurok Tribal Court to continue learning. And I do a tremendous amount of learning by listening. I just enjoy listening and learning from all of you, from everyone out in the community. And so far, this is the main thing that I have learned throughout my work as an AmeriCorps Vista with the Yurok Tribe, but now I'm working as a community outreach specialist with the Yurok Tribal Court. But this is the main thing that I've learned from all of my mentors and leaders, such as Lori Nesbitt and Judge Abby and so many individuals. But there's so much, and I've seen this back at home too on the East Coast, there's so much black and white thinking. And I just really want us all to stray away from that black and white thinking and ties to morality. There's so much emphasis on morality. This is good, this is bad, this is right, this is wrong, this is clean, this is dirty. And we have to get away from that black and white thinking, because pain is real, but so are the risks. And we have to do more understanding. We have to have honest conversations, and we have to understand that addiction, opioid use disorder, substance use disorder, any addictive substance or poison it's not a bad choice. It's like Jermaine said, it's not a moral failure. It has no ties to good or bad character. It is a disease. Addiction is a disease. And like any disease, any sickness, any illness, it impacts our behavior. It impacts how we feel about ourselves. It impacts our sense of self. And it impacts us on a mental, spiritual, and physical and psychological level. It is a disease. It is not a moral failure. It is a disease. So I hope everyone can take something away from that, and I will turn it over to Lori.
Hard to follow up that. So one of the things that working directly with the clients that I think is part of the shame and the guilt and awareness is when we meet them where they're at, it's not only the addiction, it's the trauma. And a lot of us are not really skilled to meet them where they are with that trauma. Again, we're not able to meet them where they are with possibly a mental illness or a mental illness with another family member that has impacted them throughout their life. And not knowing that, when you meet them in their addiction, there's a lot of underlining stuff that they're not able to communicate to you facing them right off the bat. Another thing is generational illiteracy is a great impact on meeting them where they are. And they're not going to tell you when you want them to fill out a form and you move it over there and basically you're signing the signature, you don't see anything. But when you want them to fill out an entire form, they're going to talk you out of it. They're going to get busy, or they got to go somewhere else, or some other excuse comes up. And that shame and guilt is a big impact on meeting people where they at and helping them. And as a case manager, I've stressed throughout the team is gain a relationship and a trust before we start doing paperwork. And yes, it takes a long time. Our agencies want intakes, but it's not the most important part. Is gaining that trust so they talk to you honestly and be able to tell you the whole picture. And when you receive a little bits of that big picture, you kind of know where to meet them at, where they're at. And with the relationships with the agencies here today, we can share possibly some of that picture without revealing the confidentiality parts that make our team better and stronger and our stakeholder continuity better. And with using Suboxone and whatever program and getting them to their treatment and their programs, we have a transportation when COVID is over that will assist on windshield time to kind of know the bigger picture. And I call it windshield time because you have them one-on-one engaged, and what else do you talk about while you're learning about them? And the other part of it is plans to distribute Narcan, and that engages them to know that we care, and to know that we care that they live, and then two is passing the responsibility onto them that they care about their loved ones to make sure that they're there during that overdose possibility. And I thank you.
Thank you so much, Lori and Micah. Again, I really appreciate your responses. Now I do want to recognize Hilda did have to get off, but I just want to say thank you to her for being on here for the first part of this panel. So now I'm going to pass the mic along to Glenn.
All right. What should people understand about our organization? Let's go with that. You know, again, we are a primary care organization, and that's where we're going to focus our work with people, as long as it's helping somebody. And you know, Jermaine was saying something about being on MAT and an extended period of time for people. I have one person that I've worked with personally, and I think he's been in a program for either 9 or 12 years. This person takes a 1/12 of a strip. Biologically, anybody that deals with this knows that's really not enough to do much. He has this perfect life for him and his family. So why would we ever change that? So to me, it's an open-ended thing. As long as it's successful, as long as it's helping somebody, I don't see what's wrong with long-term treatment. I've also seen a person that went through my program in 9 months and is doing amazing, and was a fairly high dose as well. So again, it's that individual thing, and our organization really focuses on that. One of the things I'd really like people to understand about this is who it affects. Elders and opiate use dependency. I will protect the organization that the statement came from, but we have enough Narcan out there right now, was said to me about a year ago. And I got really passionate. I probably wasn't very professional because I brought up my mom. My mom has been on opiates for a while, and they're taking it away because of, you know, the issues that it brings up in life, especially with some of our elders. And my mom had no idea what Narcan was, had never even heard of it. So how could they say to me that we have enough Narcan out there? I had a pastor friend of mine tell me that he's more concerned with opiates that are prescribed to our elders than he is with heroin, meth, or anything else, even alcohol combined, because he would watch the elders of the church be nodding out during service. And it wasn't because it was boring. It was because, well, I hope it wasn't. It was because of the opiates in their system. And he was so concerned with that he himself, and this was way before Narcan became extremely popular, he took it on himself to get Narcan and keep it in his church. So I just want people to know that it's not out there enough. OUD is such a broader spectrum than just somebody that's, you know, our houseless population. It does boil down to prescriptions, and a lot of times that's where this comes from. You break a leg, you get an injury, you take an opiate, and it grows from there. So for me, for people to know that it is more than just the narrow-minded view that the public sees most of the time.
Wonderful. Thank you so much, Glenn, for your response. I agree. Narcan is something that needs to be normalized in our communities. I also want to recognize that Lori needs to get off. So I just want to tell her thank you for joining us today. It's greatly appreciated, her words. So thank you, Lori. And I'm going to pass the mic along to Kathleen and Michael.
Yeah, I'm really enjoying this. I really like what Lori had to say, is we have to have that relationship with them. What I find out, what helps in our organization, not the big stuff, the small stuff. You know, if you have a appointment, you know, you make it. You know, if you can't make it, make sure you call them. And the small things about the good treatment, thank them for the things they can do, treat them as a equal, things like that will build that relationship a heck of a lot faster than your education. And even saying that, oh, I was one of you, yeah, I've used to do drugs and all this. No, that acting your way into their heart. And that's the way, I find out that the relationships is, and they could see the sincerity in you when you pay attention to the small stuff. You compliment them on something, what they've done different, or they got their hair cut, or they got a new pair of shoes. That shows that you're paying attention. And I find out that it can work best. Once again, education. You never know, when I'm out in the public or I'm someplace and someone will say something. I don't tell them I'm an alcohol and drug counselor, but I will educate them. You'll find out, how many people are ignorant. They just don't know. That personal touch. Our organization is small. It's Kathy and I, and that's it. That's it. They asked me last June a year ago to come in here and design a program for them. I designed it, and they hired me, and they hired Kathy, and that's it. It's very personal. But there's a fine line there between professional and personal, very fine line. And a small community like this, you got to realize that you're wearing lots of hats. I might be the counselor here, and then I go to the baseball little league park, and there's some clients, and it gives me, it makes me feel good to watching their kids playing baseball now or stuff like that. So ours is lots of training, through our certificate, the certified alcohol and drug counselor certificate I have to have CEUs. The tribe, what I work for here, the Tala Dene Nation, they love training. They love for me to show them my training. So I think that's paramount. I'm learning left and right, and my co-worker, it's amazing. After she's done training, did a training, and we're comparing notes and things like that. So that's what I want people to know about us. That we take this serious. We are professionals. This is not a job. I've been into this long enough. These 13 years that I've been in here, I have seen people these are jobs, and the people who are professional, this is a career. It's a big difference. So I will say to the utmost, we are professionals. We take this stuff serious. Thanks a lot.
Thank you. So for me, what I'd like people to understand about substance abuse is that, a lot of people go out and they may try substances, especially when they're younger, or they may do it to try to fit in. They never go, I'm going to wake up one morning and I'm going to be an addict for the rest of my life. It's like, that's not a choice. It's not a choice. It's something that happens. And Jermaine, you described it perfectly. It's a brain chemistry problem. That's what it is. We're not all built the same. someone could probably, you know, do it one time and they'll be fine. And then there's others, it's like, you know, it's like drawing the long straw, you know, you're it, sorry, or the short straw, you're it, you're the person who gets to be the addict now. And it is a disease, and that's what it is. And I just really wish that the community would understand that. And then also too, you know, before we came to this coalition, Mike and I were talking about how, too, I agree with you, Glenn, is that how Suboxone has become a stigma too, because by taking Suboxone, well, you're just trading one drug for another drug. And that's not true, you know, and educating, we need to educate our community about what is really going on instead of just, you know, we have this, what I see is we have like this good old boy mentality here in this area. And it's like, you know, let's just shut the door. Let's just push them over here. Let's not look at it. If we don't acknowledge it, it'll just go away. And that's not true. So we're just kind of like, we're not addressing what the problem is. And we're kind of like putting Band-Aids over it. And, you know, I also agree with Lori, we need more funding. There's not enough funding up here in this area. I mean, look at our mental health. Our mental health department up here it's so lacking in help and being able to offer services. It's so overwhelmed. You know, we can't address getting people into any kind of detox, because the closest detox is where? Oh, let's see, we're going to take them all the way down to Eureka or over to Redding or someplace in Oregon. We're going to lose them somewhere in between there. You know, we need immediate action here, and we don't have that. That's what I see that the problems are that need to be addressed in this area. We also don't have any in-house programs here. There's nothing here. You know, it's all outpatient. So where do we have to take them one more time? We have to take them out of the area. Well, we may lose those clients between point A to point B. How do we get them there without losing them? You know, yeah, they may be committed at the beginning, but hey, what's going to happen in between there? So, you know, these are the things that I see that need to be addressed really strongly in this area. And then I think will help take away the stigma. But the most thing that I think that needs to be addressed more than anything in this area is educating the public. We need to educate the people around us to let them know that this is a disease, just like diabetes is, or just like a cancer. Would you treat a cancer patient or someone who had diabetes this way? No, you wouldn't. You would be caring and compassionate towards them. So that's what we need to educate our community in. And that's what I try to educate the people. And then, you know, one of the things that too is that when Mike and I are approaching our clients, we're not looking at them as that they have a problem. We're looking at them as they're human beings who have a disorder that needs to be treated. That's all they are. That's it, you know, and pointing out the milestones, no matter how big or small they may be, we always point out those milestones. It's like, wow, look at that. You changed your thinking. You a week ago, you would have approached it in this way, but today, look at what you did. That's completely different than what you would have done. So to point that out to them is like you can see the light bulb come on over the top of their head. And, you know, I agree with Mike. I'm a professional. This is not a job. My clients call me at 11:30 in the morning when they're at night, you know, when they're having a crisis. My phone is always available. And my family understands that. They know that I am a substance abuse counselor, and it's not always convenient. You know, people don't always have crises during the day between the hours of 8 and 5. It doesn't work like that. You know, people have crises at 10 o'clock at night. People have crises at 2 o'clock in the morning. And, you know, I let them know that, hey, if you have a crisis, I'd rather have you call me than, you know, go out and use or do something wrong in your life. And, you know, most of the time they do call me, and I'm okay with it. So that's all I got.
Thank you so much, Michael and Kathleen. Very moving and very honest. Like, this is something that we really need to just, you know, get normalized into people's minds, that this is, like you said, this is a sickness. So thank you for your response. And I want to pass the mic along to Molly.
So, yeah, I think everyone kind of said everything I was going to say. I think like the one takeaway I would like to share is just that, yeah, this is poison essentially. And when people overdose, it's a poisoning. And, you know, I think we've normalized pain meds in the community, but I don't think we've normalized MAT or Narcan or things that are also a part of that world, you know, maybe like the not so pretty side of it, but like addiction isn't pretty, and we're dealing with people who are sick, and it should be treated that way, the same as cancer, diabetes, all of that. It's not a character flaw. I think we're kind of coming out of that thinking. I'd like to think. I really hope, you know, that our healthcare system and our criminal justice system changes to reflect that and that new way of thinking, because we're, you know, incarcerating people and institutionalizing people who are sick, who need help. Just the one thing that I would say is really important to educate the community. Doing this kind of work, you know, and talking about it, when people ask what I do, I always kind of watered it down. And I'm really trying to not do that anymore because I think it's a disservice. And, you know, I think it is a crisis and people are dying, and there's people on the street who are sick, who are also being stigmatized. And I think it's not going to pay off to be silent and to be, you know, it's not pretty. And what people are seeing, like, you know, on the street isn't pretty, and what people are seeing inside their homes aren't pretty. And it's happening anywhere and everywhere in every little corner of the United States and all of that. And so I think it's really important for us not to stay in our lanes. And I think about collective impact all the time. I think about like my role and what I'm doing. And even though like I had a more direct role in the past, and I felt, you know, very, I felt like that was very beneficial. I'm also just thinking about like what I'm doing now, and that also someone needs to do it. And I am making an impact just in a different way. So that's about it for that. Thanks.
Thank you so much, Molly, for your response, and we appreciate the work that you're doing. Now I'm going to pass the mic along to Rob.
Hello again. So one of the things that we found with our Opioid Awareness Coalition over a year ago is that our community didn't even know the services that we had at the time. And I think that's especially important in the times of COVID for our clients to make assumptions of things just aren't available anymore because of the shelter in place orders and people staying at home. So one of the things that I would just really encourage clients of UIHS to do is to maintain that contact and connection with the services that they had, whether that to call their counselor, their substance abuse counselor, talk to their medical provider, and see what's available. I know that there's been a lot of work as far as with increasing our technology capacities, getting creative in how we connect with our community. I know with us in health promotion and education, we're giving medication lockboxes who we typically would give to our community members ourselves. We gave them to pharmacy, which is a natural place to distribute those things. We also have our CHRs within community health and wellness, who instead of doing home visits, they're doing porch visits. And so we're able to maintain some of that social distancing and still being able to have that contact with our community. You know, we don't want anything to happen health-wise to our community members by just neglecting to address issues, thinking about the whole person. So whether that be, mental health, behavioral health, or our physical health, we want to see you. There's different procedures than normal, which, was pre-COVID, where there's temperature taking and masking within our organization, but that's just for the health of our staff and for everyone that comes and engages in our services. But many services are still there, they're still available. They could be through telehealth, they could be there in person on certain capacities, but just to maintain contact with the clinic and the providers that you used to see. So, we would love to hear from you.
Wonderful. Thank you, Rob. And thank you everyone for your responses. We are about 10 minutes out and I do want to respect all of our panelists' time. So if any of our viewers have any questions, you can raise your hand or leave it in the chat box under the Facebook chat or the Zoom chat. And we're gonna just ask our panelists, like, how can people get involved? What's one thing that people can do to get involved? So I'm gonna start off with Jermaine.
So my one thing is come to the Wellness and Recovery series, get educated and find out more about what's going on in our communities.
Wonderful, thank you. Maikia?
My one thing is to get involved by volunteering and participating in the Wellness and Recovery series, coming out to the Yurok Tribe Wellness Coalition meetings, which are monthly, Del Norte RX Safe meetings are monthly, Oak Coalition, Humboldt RX Safe Coalition. There's so many opportunities to get involved as a community member and to volunteer.
Awesome, thank you. Glenn?
I have to agree with everything we just said. Get educated, have conversations, and then get out. After you do that, get out there, get involved, and you'll see where the need is in your community. One thing people can do is, if we make this a normal part of conversation, like diabetes and other issues like that, we won't have a chance for change. I highly recommend TED Talks for stigma reduction. There's some amazing ones that talk about diabetes and heart disease, and how callous we would be if we took the same attitude that we take for addiction.
Awesome, thank you. And Kathleen and Michael?
Yes, the way to get involved is give us a call. We're more than welcoming you. We'll talk to you. We'll educate you. We will refer you to the right places. If we can't help you, we will help you. We could do a red road, and we need mentors. We need the elders. We need people to show the way. That is more than welcome. Yeah, we just need the calls. Let's talk. Thank you.
I'm just going to agree with Michael so the rest of the panelists can chime in.
Oh, thank you so much, both of you. And let's see. Glenn, did you go already? All right, I'm sorry. Molly, would you like to go next?
Yeah, I just want to say, like, kind of what everyone else said, and also just keeping collective impact in mind. I feel like that's been really helpful for me, and just trying to figure out what you can do to give back to just kind of keep pushing the needle forward.
Wonderful, thank you. And finally, Rob?
Yes, so I'm going to go ahead and follow us on Facebook at United Indian Health Services, and my section and our team is at UIHS Health Promotion and Education. We have our Opioid Awareness Coalition that is on the first Friday of every month in the afternoon. Due to the holiday tomorrow, it's going to be next Friday. So if you want to join that coalition, give us a call at 888-848-5070, and we'll get you the invite and email you, or follow us on Facebook.
Wonderful. Thank you, Rob. And thank you to all of our panelists for joining us today. Very inspiring and very heavy work that you're all doing, and it's greatly appreciated. Like I said before, like, you're all my heroes, and yeah, I appreciate that, all of the work that you're doing, and for sharing that today, because I know it is a very heavy and draining topic, but you all are wonderful. So thank you again. I do want to remind everyone that some of the stuff we may have brought up today, may be kind of heavy, and it may bring up some emotions and concerns, feelings. And so if you do need to reach out to someone, you can reach out to the mental health line in Del Norte that we have here. The 24-hour crisis services are also available. So I just want to remind everyone, if, we went through some heavy topics today. So if you need that, definitely reach out. And I just want to say thank you again to everyone who joined us as well, all our panelists, all our attendees, and those watching on Facebook. Thank you for watching today. We really appreciate your participation. It is important for you to be here just listening. And if you do want some more information about our panelists today, you can reach out to the Wellness and Recovery Series page, and we will try and get that contact out to you if you want to reach out or learn more about these coalitions and organizations. For some more information on the summit, you can follow our Facebook page at the Wellness and Recovery Series. You can check out our RX Safe Del Norte website, and just the RX Safe Del Norte Facebook if you want some more updated information. If you haven't registered for our Eventbrite for the summit, please make sure to do so, because then you stay updated on everything happening, just like this panel today, and you can get more information about our panelists there, and get more information about some upcoming fun activities as well, such as raffles and drawing challenges. Please remember to fill out the evaluation form at the end of this panel, because it really helps us out, and it will give you an entry into our Wellness and Recovery Series raffle, which we'll be announcing at the end of the series. And you can win some really nice, fun wellness and just feel good gifts. So make sure you fill out that evaluation form and fill it out to the best of your ability. Any entry is appreciated. So again, thank you to our panelists today. We appreciate having you. Thank you to all of those watching, and we hope you have a wonderful weekend.
Thank you. And I just want to highlight something that Glenn put in the chat. Was another way you can get involved is to push your elected officials to support recovery and efforts. Many of us talked about needing funding, and a lot of those places can make sure we have that funding. So talk to your officials and get Narcan trained.
Yes, thank you. All right, thank you everyone. You have a wonderful day. We appreciate having you.